For as long as I can remember, my Uncle Kenny bowled, smoked, and drank. And believe me, he loved to do all three. He has won 9 300 rings, smoked a pack or two a day, depending upon the day, and other than my aunt, liquor was his best friend. The older my uncle got, the worse off his legs became, but all he did was attribute it to his getting old. Until one day, the pain became so great that my aunt took him to the hospital. It was here that he was diagnosed and told that the cut on his left leg was now gangrene. For the next several minutes, I will be informing you of the disease known as gangrene, along with 4 different types, the symptoms and causes of this infection. I will also be informing you on the ways to treat and help prevent this infection. I will begin by telling and explaining what gangrene is and the possible ways of becoming infected. I will also discuss which areas of your body are more prone to the infection. Gangrene, if left untreated, can be fatal. It is very important to understand the nature of this infection. Gangrene is best described as dead or dying body tissue, which has lost or significantly reduced blood flow. There are multiple types of gangrene, but the 4 most common, which I will be discussing today, includes dry, wet, internal, and gas gangrene. Some types of gangrene involve bacterial infections, such as wet, internal, and gas gangrene. The areas of your body most commonly affected by gangrene are the extremities, such as your fingers, toes, and limbs. But gangrene can also affect your internal organs and your muscles. Gangrene is a common occurrence in the United States. Therefore, it is extremely important for individuals to be able to recognize the symptoms of this infection and seek medical treatment before the damage is too severe and leads to death. Many people believe that the symptoms for all gangrene are the same. However, this is false. The symptoms vary depending upon the type of gangrene, the anatomic position, and the organ system. So it is very important to be able to recognize the warning signals for the gangrene infections. There are multiple types of gangrene. Here I will be describing the 4 most common cases of gangrene and their symptoms. Dry gangrene often begins with the affected area becoming cool and numb to the touch. The area will then begin to discolor and have a reddish appearance that then turns to brown and eventually to black. The affected area will begin to shrink, look dry, and have almost a mummified appearance. Wet gangrene begins with swelling, leading to severe pain in a particular area. That location may begin to appear red and showing signs of decay, such as pus and an oozing of fluid. The affected area may begin to produce a foul-smelling odor. This area also begins to look moist and black. Internal gangrene you cannot observe because it affects the internal organs. The person may become very ill with pain and swelling around the organ infected. For example, gangrene of the gallbladder would cause extreme pain in the upper right side of the abdomen. Gas gangrene is a fast-spreading infection of muscle tissue. The bacteria of the infection produces a gas that becomes trapped within the affected tissue area, and that location will become swollen with severe pain. The common cause for all gangrene types is a loss or slowing of blood supply to any tissue or organs. There are other attributing factors that help aid the beginnings of gangrene, and these factors include multiple ways for the infections to occur. Disease or addictions, such as diabetes, arteriosclerosis, and a tobacco addiction. Injury or trauma, such as a crash injury, frostbite, or a very severe burn. That could also be attributed to any infected areas that are not kept clean and covered. There are also several risk factors that increase your chances of developing gangrene. A person's age is a factor because gangrene usually is more often and more oftenly occurs in an elderly person. Diabetes. For if you have diabetes, your body may not be producing significant amounts of insulin, or it may be resistant to the effects of that insulin. Arteriosclerosis. Having hardened or narrow arteries and or blood clots can affect the blood to any area of your body. Severe injury or surgery. Any process that causes trauma to the skin and any underlying tissues. Immunosuppressant. An infection with the human immunodeficiency virus, HIV, or if you are undergoing chemotherapy, or radiation therapy, your body's ability to fight off an infection is impaired. Now that you have a better understanding of gangrene and the seriousness of this infection, along with the ways to identify the symptoms of the gangrene, I would like to give you information on how to rid yourself of the disease. I will also provide information to help you from ever contracting the infection. We already discussed how each type of gangrene is different with different symptoms. Along with the different types and symptoms, each treatment is also different. Treatment is based upon the individual infected, the type of gangrene, and the area that is infected. Even though all the gangrenes can be treated differently, each type needs medical attention. Dry gangrene is usually treated by a surgeon that removes the dead tissue through surgery. Wet gangrene is a medical emergency and needs immediately treatment. The dead and dying tissue needs to be removed before it spreads to the blood. This is also done through surgery. If the damage is severe, a skin graft can be used to help heal the patient after the infection. Gas gangrene needs to be treated aggressively. This is because the infection spread rapidly through the bloodstream. It requires removal of dead and dying tissues and antibiotics. This specific type of gangrene also has a special procedure called hypobaric oxygen therapy. In this therapy, the patient is placed in a special chamber. The chamber is then pressurized with pure oxygen. The pressure will steadily rise until it reaches about 2.5 times the normal atmospheric pressure. This therapy is used to increase your bodily oxygen content. By doing this, your blood can carry more oxygen, which inhibits the bacterial growth of the infected area. If the infected area cannot be salvaged and the infection looks to spread elsewhere, there is also amputation of the infected bodily area. Gangrene is the spread of a bacterial infection. There are many ways to help prevent the occurrence if you encounter gangrene. Keep wounds dry, clean, covered, and sterile. Watch for any signs of infection. Those with diabetes should control blood glucose levels. Avoid severe frigid temperatures so you will prevent frostbite. Avoid all tobacco products. A well-balanced diet to avoid the clogging of arteries with cholesterol. It is important to become educated about gangrene and how you can prevent it from affecting you and those that you love. With those thoughts, I would like to bring my speech to a conclusion. For the past several minutes, I have spoken and informed you about gangrene. I have explained how it is an infection caused by bacteria and that there are different types of gangrenes that can infect your skin, internal organs, and muscle. I have spoken of what can happen if you delay on receiving medical treatment, including surgery, skin grafts, and even amputation. I'm sure you're curious as to what became of my Uncle Kenny. After battling his gangrene in the hospital for a week, the doctors informed us that the arteries in his leg had collapsed and there was no saving his left leg. He now has a prosthetic leg from the knee down. He has quit smoking. He has also changed his diet to keep the rest of his body healthy, including not drinking. Sadly, he has not been able to bowl as of yet, but he's still doing physical therapy to try to be able to bowl once again. Anytime that anyone asks, he is more than happy to tell the story of how gangrene helped him get his stubby. Thank you so much. Have a good